When a patient visits our office for a cleaning appointment, we are going to evaluate their gum tissue and their bone levels. And on occasion, you'll hear me mention a patient has periodontal disease. Periodontal disease is basically caused by the bacteria that is in everyone's mouth. And this bacteria has found a way to migrate through the gum tissue, and it's gotten to the bone level, and it's starting to damage and melt away some of the bone, which is holding those teeth in place. That bacteria needs to be removed from those pockets around the patient's teeth. And we have various ways that we make some measurements and determine how severe the periodontal disease is. But periodontal disease has to have bone loss for us to diagnose it. I call it an insidious type disease because there's really no pain involved. Unfortunately, tooth loss is the end result because we lose, as I tell patients, the cement that's holding that bone in place because the bone is melting away. There is a treatment for periodontal disease. It will stop that bone loss, but we don't put the bone back. We really need to have you come into the office for an evaluation. We'll take the appropriate x-rays, we'll make the appropriate measurements, and we can determine if you have periodontal disease and offer a treatment. In a severe case of periodontal disease, a referral will be recommended to a specialist to treat that periodontal disease. But again, we just really need to evaluate your situation.